We prefer that you make an appointment to see us. This is because we want to not have long waiting times when people come here. If you come here without an appointment, you might have to wait a long time to see someone. When you arrive at Danila Dilba, the first thing that happens is the receptionist will ask you for your name. The receptionist also checks things like your date of birth, address and other information. You might also be asked to fill out a form that we need to give you medicines that we pay for. You will then be asked to stay in the waiting area. Your Aboriginal health practitioner or nurse will call your name and take you to their room. When you go to their room, they will ask you about your problem and check your medical information. They'll also check to make sure you haven't missed any other appointments or if you are missing any test results and other health information about you, like what medicines you might be taking, if you have any allergies or other problems we already know about, and if you've had your flu shot. You will also be asked for permission to do a full health check. Health checks look at things like your blood pressure, seeing how much you weigh and how tall you are. Everyone should have a health check once a year to make sure their health is staying on track. If you have a health issue like diabetes or heart disease, the health practitioner or nurse might check up on how you are going with this and might also take some blood to send for a test.
Sometimes people worry that their personal and private information may not be kept safe and secure and confidential. At Danila Dilba, we take it very seriously that people's personal information and records is safe and secure. We also have systems in place to make sure that those records are not accessed by staff who shouldn't be authorised to do so. And should any member of staff access those records when they shouldn't have, then that would result in their instant dismissal.
As part of your health check, we will ask if you need to see a dentist. You can only see the Danila Dilba dentist if you have completed this health check. Part of our health check includes questions about how you are feeling or your well-being, if you are doing physical activity and what you are eating. You might be given information about these things that you should take home and look at. All of this is an important story for your doctor, who will then see you after the Aboriginal health practitioner or nurse. The doctor will then do things like write a prescription for medicine. If you have a problem like diabetes, a kidney or breathing problem that may need other people to join in your healthcare, the doctor will complete a care plan for you and write a letter for you to take to see a specialist. You might be able to see that specialist at Danila Dilba, or you might need to go to a service outside of Danila Dilba like the hospital. Once you have seen the doctor, you will need to go back to reception and make another appointment. If you need transport to and from the clinic, please let the receptionist know when you make your appointment. To help Danila Dilba, it is important you always bring your Medicare card or healthcare card with you to appointments. Please give at least 24 hours notice if you need to cancel an appointment so we can let someone else in. While you have rights as a patient like safety, respect and privacy, we ask that you help us by respecting other clients, health service staff and our buildings and resources, taking responsibility for decisions you make about your health and care, being on time for appointments or letting us know if you can't make them, and being sober for appointments, being as open and honest as you can and letting Danila Dilba know if your health changes. Ask questions if you don't understand. We also love to hear your feedback and you can ask reception for a feedback form. Or if you have a complaint, please ask them how to do this.